Hi everyone. Today I will introduce you something about peripheral nerve injury. I'm from Department of Orthopedic Surgery. My name is Zhu Haitao. The first section is a general introduction. I will show you the anatomy of peripheral nerve fibers. Look at this schematic diagram. The nerve fiber is like a cable connecting the central nervous system and their target organs. The nerve fiber transmits signals from the central nervous system to let the organs perform their function. According to Seddon classification, the first type is neuropraxia. That means temporary loss of function. The structure is without damage, and the function can restore in several days or weeks. Usually, this kind of injury is caused by slight traction, short-term compression. The second type is axonotomesis. That means the distal part of the axon degenerates and disease. Most function of the nerve fiber can recover. This kind of injury is usually caused by blunt heat or persistent compression. The third type, neurotomesis, that means completely loss of nerve function, and in this case, operation is often needed. Let's see the pathological changes of the injured nerve fiber. This schematic diagram shows you on the left, that means blunt injury, and the right, the sharp injury. The clinical manifestations and diagnosis. The first, motor dysfunction. Nerve fiber injury can cause flaccid paralysis, tendon reflex diminished, and muscle atrophy, some special deformity. Second, sensory dysfunction is touch, pain, and temperature. Autonomic nerve dysfunction, change of skin temperature and sweat pattern. Often the nails are affected. Fourth, Tenno test. Compress or knock at the injury site. The pain radiates to the distal part. It's an implication of recovery. The fifth, neuroelectrophysiological examination. We often use EMG and SEP. For treatment, the therapeutic principle is restore the connection of nerve fiber as early as possible. Methods for close injury. We give necessary medicines and physical therapy. We can keep observation for 3 months. And methods for open injury. Mostly, in this case, operation is needed, but that depends, such as cut or smashed injury, whether contaminated or not. Maybe in several phases to complete the operation. The operation methods, the first is neurolysis, clean the scar, decompression of the nerve fiber. The second type is neurosuture. On the left, you see external membrane suture. On the right, you see bundle membrane suture. And these 3 types of operations, you can see nerve transfer, nerve transposition, nerve implantation. This means sacrifice the less important nerve to restore the more important nerve. Section 2 is about upper limb nerve injury. I will show you the bronchial plexus. You see the anatomy. The bronchial plexus is formed from C5 to T1 nerve roots, and they formed the following nerves. First is musculocutaneous nerve, second axillary nerve, third radial nerve, the fourth median nerve, the fifth ulnar nerve. They perform important functions on the limbs. First, to show you bronchial plexus injury. It's mostly caused by traction in traffic accidents. Its manifestation is very complicated, depending on the injury site and injury extent. If the injury is occurred, the entire arm may be affected, both in sensation and movement. For treatment, if the injury is open, we need an operation to help the victim. If the injury is closed, we can keep observation for 3 months. Second, median nerve injury. On this map, you can see dark lines that indicate the median nerve. Mostly, median nerve injury caused by appendicular fractures in children and sometimes in wrist card. Manifestation: dull or diminished sensation of the index and the middle fingers, especially the distal segments. Flex dysfunction of thumb, index, and middle fingers. Treatment: if the injury is closed, we can keep short-term observation. If there is no sign of recovery, we need an operation. For open injury, we give an operation. Third, ulnar nerve injury. The same, you can see the dark lines that indicates the ulnar nerve. The ulnar nerve injury manifestation: dull or diminished sensation of the ring and the little fingers, especially the little finger. Flex dysfunction of little finger distal segment, and a special deformity of claw hand. The treatment is early operation. These maps show you the distribution of sensation zone. The fourth, radial nerve injury, often resulted from humeral shaft fracture. The manifestation: dull or diminished sensation of the distribution zone, and a special deformity as dropping wrist. The treatment: we can keep observation for 2 to 3 months, and then we need operation. Section 3 is about lower limb nerve injury. This map, you can see the yellow lines that indicate the important nerves. The first is about femoral nerve injury. This kind of injury is relatively less common. The manifestation: paralysis of quadriceps femoris muscle, and dysfunction of knee extension, medial shank dull sensation. The treatment: if the injury is closed, we can keep observation, and if the injury is open, we need an operation. Second, sciatic nerve injury. Manifestation means paralysis of posterior thigh muscles, low leg muscles, foot muscles, posterolateral shank and foot dull sensation. The treatment is operation. Third, tibial nerve injury. The manifestation: paralysis of posterior shank muscles, foot plantar dull sensation. The treatment: we can keep observation 2 to 3 months. Common peroneal nerve injury. The manifestation is foot drop, and treatment: we use operation.